Hello and welcome to another edition of Russell Reynolds' podcast series on sustainable leadership in action. My name is Anupama Puranik and I lead healthcare for Russell Reynolds in Singapore. And I am joined by my colleague, Dana Krueger, who leads healthcare globally at Russell Reynolds. Our guest today is the Group CEO at Fullerton Health in Singapore, Kuen Loon Ho. Kuen is also the chairman on the board of Fullerton Health Indonesia and the RadLink Group. Kuen was the COO for Fullerton Health and the GM for Singapore in his previous role, and he started at Fullerton Health as the CFO. Prior to joining Fullerton Health, Kuen was Group Chief Financial Officer of Keppel Integrated Engineering, where he started as a Keppel Scholar. Kuen also has formerly worked as a management consultant with McKinsey and Innosight LLC. Kuen has an MBA from Harvard Business School and a Bachelor of Accountancy from Nanyang Technological University. He brings more than 20 years of work experience across Asia Pacific, USA, Europe, and the Middle East. Welcome, Kuen. It's lovely to have you here.
Thank you so much, Anu. Glad to be here.
So as we collectively set out to recover from the COVID-19 pandemic, how are you thinking about talking about purpose?
So I think first and foremost, COVID-19 is actually a health crisis. Right, that leads to an economic crisis, right? And so for us, we are just very fortunate that we are in a way in the right place, right? Because we are a healthcare service provider, right? And in this time of crisis, it just brings our purpose so much more. And our founding purpose since 10 years ago, and we are celebrating our 10-year anniversary this year, is to provide affordable, accessible care to all in Asia Pacific. What is interesting is that in 2.5 years ago, we actually revisited to say, is that still the right purpose for us as an organization? You have to understand that when the founders started the organization 10 years ago, we started very organically and in Singapore. Right? Today, we are in 9 countries. We have more than 550 clinics and about 10 million patients. But 2.5 years ago, we're at the checkpoint where we say, is that still the right purpose to move forward? And we say yes. Right? And this time is with the collective agreement, right, with all the leaders that we have in all the countries. And with that, and with the crisis that set in since March, it's just bring us out to say that why we are in this industry and what can we do. And that has been the guiding compass for us in the last 6 months, I would say, in the way how we take care of our patients, in the way how we care for the community, how do we contribute to this health crisis in terms of the recovery, and how do we take care of our clients as well. And when we talk about affordability, it's all about beating the inflation, how to make it affordable. And when we talk about accessibility, it's really to provide care to more people that we care about. And so the number of lives is the key metric to us. So in both areas in this COVID-19 crisis, we have thought a lot about how to work with the government, because a lot of the initiatives are government-led. So this leads us to more than 15 projects across the region that we are involved with a government-related level, so that we are able to be involved, right, to help to solve the problem, how to bring care to the community, how to do the swiping, how to do the serology test. Right? So for example, in Singapore alone, we were involved in 8 different projects, and that includes doing caring for the migrant workers, almost 100,000 of them. And we work in projects that we've never done before. And that really bring out the essence of the purpose, right? Things that we've not done before, but because it enables us to bring affordability, accessibility to the general population, and in this crisis, we will do it no matter what. So I'm actually very proud of the team that we have gone out of comfort zone to be able to contribute to this.
If you think about how you approached this as a leader, this sort of doubling down on your purpose and maybe even changing the way you interact with potential partners or customers or communicate around your purpose, what would you say that the key 1 or 2 things in your leadership style that you changed in order to adapt to the current situation?
I think when the crisis happened, we got to change, at least for a period of time, from being long-term focused to very short-term focused, very immediate. Entered the year with great plans. I mean, I took on the CEO at the 1st of January, right? So you have a 5-year plan, how you build an organization, how do we live out the purpose for the long term. When the crisis set in, you sort of have to put that aside. And I think that's important. And that's where I think the reminder to our leaders to be agile, to be flexible, to be adaptable is really key. Right? Because it's suddenly within 2 months' time, we have just to switch their mindset, right? To say that let's just park that aside first. Let's deal with the current situation. It's a crisis, and just focus on really caring about the patient first, and the safety of people is key because we have thousands of people at the front line have direct contact with COVID positive patients. So their safety is key. So let's prioritize that more than ever. And then secondly is the patient, right? How do we bring more care to the patient? And the discussion of the economics sort of take a second priority. And it's more about contributing to the community that will come first. Do first, and then we'll sort out the rest later. If this is the right project for us to do, let's take on the project and figure out how to do it. It's sort of a different dynamics where it's compared that you do a lot of planning, you work out your ROI, you work out IRR before take on the project. In such a situation, it's really the other way around, right? Is this the thing that we think we can do, even though we have not done it before? Let's accept it and then let's figure it out. Right? So that has to be the guiding principle, and I give credit to my team that they have been very agile. I think that give us the ability to contribute in the last 6 months.
Anything else you're doing in your day-to-day to anchor purpose in what you're doing? Because I'm assuming that this now becomes part of the long-term plan, really leading with purpose.
That's true. I think a couple of things is really important about it, right? First is you need to talk about it very often. You just sound like a broken record and just keep reminding people what's our purpose, why are we doing this, and keep reinforcing it again and again and again. Because otherwise, in a very profit-driven world, sometimes you don't go back to why you're doing certain things. So I think one is really to talk about it. So we talk a lot about it in our meetings, in my leadership meetings, in my meetings with leaders. For example, in most of the meetings, we start off with one person sharing, right? What's the case study, right? How have you come across? How we live the shared values? Because the purpose is driven by the 5 shared values that we have in the organization: compassion, teamwork, partnership, integrity, and innovation, right? So those are the 5 shared values that drive really the purpose. And we talk a lot about it. I think that's one. 2 is as the leader, not just myself, but my fellow leaders and the fellow leaders and the subordinate, right? You got to walk the talk. I think that's really important. If you talk and you don't walk the talk, I think then there's a disconnect. Right? So that's also a daily life. And finally is really to showcase, right? When people really live the purpose with the shared value, we really should share the case example, really to acknowledge it, how they have done it, why they have done it, right? And those will just reinforce each other. Really the 3 steps that we do on a daily basis to try to reinforce, right, and to anchor the purpose.
How would you sort of assess people that you bring into the team, the leadership that you're hiring into the team? How do you sort of make sure that they are aligned to that sense of purpose? How do you build that into them once they come on board?
That's a very good question, Anu. I think when we have sort of put in cadence a few things. I think when we now have the conversation with potential candidates or potential future teammates when we first talk to them and we interview them, right? I think a lot, instead of just focusing on what can you do, we also talk a lot about their value system. We also talk a lot about what do they believe in, how they can contribute as a member of the team, not just in terms of the economics, right, but also in terms of the dynamic and whether they believe in the purpose statement or not. But you got to strike a balance, right? Because to be just very honest, end of the day, we are still a profit-driven organization. I mean, we still have stakeholders and shareholders to be involved in, and we cannot just bring in people just have a complete purpose-driven and yet do not balance out with the financial economics, right? I think the new word is to find something that's balanced, right? Not to one extreme end, right? Because if you are purely focused on the purpose, I think they may be better off in a non-profit organization, to be very honest. But having said that, so that is where we need to strike a balance when we bring in people and we talk to them. And then when they are in already, I think it's really, we have not done what we're going to do, and we're starting soon, is to put into our performance appraisal, right? And it's not just how competent they are in, how many KPIs they have achieved, but also evaluate them based on whether they have lived, right, the purpose and the shared values that we have. So there's a criteria on that, and we're adding that in. And we're starting in small steps, right? In the sense that this year we have a trial run to say that that's being evaluated. That's not part of your KPI yet. But next year onwards, in year 2021, that will be a part of the weightage. Right? And we just hope through this change, people realize that we are really serious about it. We're walking the talk.
That's fascinating, Kuen, particularly around aligning the incentive system to the behaviors. Kind of goes back to basics when it comes to leadership and management. But can you tell us a little bit more about the concept that you have? Because, of course, living the values is in a way easy to see, but hard to track. So how are you thinking about operationalizing that?
So to be honest, that's why I say we are taking smaller steps to try to operationalize it, because this can be quite subjective. We try to ask a very direct question. So for example, in compassion, we have 5 questions, right? So when we do evaluation, we will ask the appraiser and the appraisee to say that from 1 to 5, have you done this or not, right? Where are you now? So those were the questions that we put in. I think that's our starting point, but over time we need to refine it. My sense is that as the start, we will have a general question for everybody. But over time, I suspect the question will be different from different seniority level and different for people at different functions, right? Compassion will mean different to a person who is a nurse at the front line versus a finance person at the back end. So we need to continue to tweak. I believe it's a learning journey. It will take us 2 to 3 years to really get to something that we are comfortable in, because it's again a balance of not over being generic, but not too specific as well. But I think we need to start off with something, right? And we need to start off with a vision and end, and understanding it's a learning journey and it's a process to get there.
Well, we look forward to learning from you on how that's going, but we're hearing across the board from clients steps being taken in this direction, because you're right, it's not only about profit, but it's about people and it's about society, which is what we mean when we talk about sustainable leadership. So again, you sound like you're very much on the forefront. So hats off. Maybe to zoom out again, as we've heard in the setup that Anu provided to the beginning of our conversation, you do run one of the largest and most influential healthcare provider associations within Asia Pacific. So you also play a very important role to the industry. And so I guess the question is, what impact do you hope to have, or what role do you hope to play in advancing and enhancing, the overall purpose of the industry? You're living it as Fullerton, but how would you like to influence the rest of the ecosystem?
I think there are 3 levels that we think about this. I think one is just from the principal values that we believe in, which is a universal health. How do we play a part, right, in being more advocating the private sector participation, right, for the universal health coverage? So that's the principal level, at the private level participation at the universal health system. I think there's a lot of talks, and in the past, paradigm is always the universal health system has to be from the public sector. Increasingly, I think the private sector has a role to play. And how can we contribute to that? Right? And taking a part of the public role or in collaboration or things like that is a big topic, but I think that's something that we are very keen in. And in different countries, we have to probably play a different role in that broad spectrum of universal health. I think that's one theme. I think the second theme is our involvement in the World Economic Forum. And we have been quite active in this particular area I mentioned earlier, universal health coverage, private participation at the Economic Health Forum. We have been a member of Economic Health Forum for the last few years. And one of my founders has been taking the lead, right, in this area in a couple of countries as well. So that is in collaboration of a leading organization to do this together rather than do it on our own. But finally, also on our own and in partnership in a more local level, we do drive a certain initiatives. For example, we are very active in Indonesia, starting in Indonesia on tuberculosis screening. And it's actually quite interesting because even until today, the statistics show that probably more people die of TB than from COVID-19 actually, right? And because everybody talk about COVID-19, people forget about the 3 things that have not been fully resolved, right? The TB, the malaria, and HIV. Right? Those 3 health issues has killed more people even until today. And because of COVID-19, resources are channeled there. Actually, there's even more issue because that area has been neglected. We have been championing TB in Indonesia. We've done a lot of health screening. We work with a lot of fellow partners like Philips, like Johnson & Johnson, and many others, right? That these projects actually allow other people to access to healthcare again in this particular area. So my third point is actually at the local level on a specific disease that we want to focus in as well, so that we can also bring in very tangible and actionable steps, right? And I'm proud that the team has reached out to probably close to hundreds of thousands of Indonesians But because of the COVID situation this year, there's a lot of slowdown, but we do want to continue to champion it again, because I just reminded, I read so many articles to say that everybody just forgot of COVID-19 and forgot about other diseases which has been around for the 2030s and killing more people.
Thank you so much. This has been so interesting to hear, especially the last point you made about joining hands with the pharma and the devices sectors as well, which actually puts the trinity together in a way, right? Pharma, devices, healthcare, delivery services, to sort of look at an integrated care model across together. And the fact that you're doing this more out of the sense of purpose is extremely heartening to hear about. Thank you so much for your time today. This was a wonderful conversation and really enjoyed having you on our conversation today.
Thank you so much, Anu. Thank you, Dana. It's been a very enjoyable session.